All right. Now let's go ahead and launch the webinar.
All right.
Well, hello. I'm very excited today to get things started. Life's Co-Pilot, and we've got news. We have basically kind of incorporated Life's Co-Pilot within being sponsored by Caring Transitions Indy North and all of our professional members that are members of Life's Co-Pilot. Well, today we have an expert coming in to speak to us. Barbara Gaynor she was a nurse advocate. And Barbara, where are you from?
I'm living in Cincinnati, Ohio.
Okay, so you're just skip down the road a little
Yeah,
bit.
just to skip down the road.
Okay, so and by the way, you're in the hometown of where our franchises, the headquarters are. It's in Cincinnati.
Good.
So what I just wanted to touch base with and introduce Barbara. She is going to talk to us about a topic that if you've ever been in the hospital, or if you've ever had a family member in the hospital, and if you did not stay with them and you were not there as an advocate for them, you found out that that's not necessarily a great situation to be in. So Barbara's going to talk to us today about how to have a safe, productive, effective hospital stay. Is that fair enough?
Fair enough.
Okay.
Fair enough. Stay safe and sound hospital stay. Yes.
Because it's not something that just happens automatically, is it not?
No, and a lot of people just they trust the hospital system, and that's not a bad thing. But at the same time, if you don't advocate for yourself or your loved one, you can spiral out. Things can spiral out, and you see this doctor, that doctor, and nobody's talking together. And then you're like, okay, what did somebody say? So this here kind of gives you a guideline. And I do have a handout that I'll send to you later on that you can post
Okay.
out to give your audience just to help them to understand, hey, I do have rights and I can, get the help that I need. Yes.
Well, that's awesome. Well, would you? I'm going to turn the thing over to you.
You can turn it over to me. Oh,
yeah,
wow.
It's all you.
Oh, wow. Okay, so let me get this going here. My PowerPoint. Oh, I'm sorry. Let me do this. I think I've got it. Show the slide, resume slide. Okay, so this is about having a safe and sound hospital stay, how to get the care you want for people you love, even for your loved one. So this presentation is being brought to you by a company that I am affiliated with. It's a non-for-profit. It's called the Caring Partners Project. It's run by a lady by the name of Karen Curtis, and she is so awesome. She had personal experience with hospital system, and so she didn't like what was happening, period, as far as, everything happening in the hospital and talking to different doctors and all that sort of thing. So she went ahead and she decided, let me do a non-for-profit. So let's see, next slide. I'm sorry, this is, so let me go to the next slide. Okay, great. So I am Barbara Gaynor, and I wanted to thank Jim for helping me to come onto this program here. I am a nurse, a registered nurse, a legal nurse consultant, and also a board certified patient advocate. And as I said, I'm also a part of the Care Partners Project community. I do education for them. My company is called Braddock Consulting and Advocacy, and this is my contact information should you need me. Okay. So caring projects, the Care Partner Project is is, as I said, a non-for-profit. So if you like what I've said, and so you can go onto their website and you can do a donation, or you can find a plethora of information on their hospital stay checklist, surgical checklist, tips and tricks, all that sort of thing. But it's got a wealth of information. And if you ever have a community that wants to have someone to talk, you can have that too. Just get in touch with with Karen. Okay, so today we are planning to um, get into a little bit more about what is happening with you when you get to the hospital. The overview of medical care, why achieving the best care is not just a simple situation, but having the best facilities and the brightest personnel. And then you'll have quick tips and great resources on how you can gain this. And I will have a handout. I'll send it to Jim and he can post it in the group. Thanks. Okay, so first thing, if you're going to the hospital, bring somebody. There are a lot of solo agers that are out there that really don't have someone. So get yourself an advocate, a church member, a family friend, or just a person or a family person to go with you. 2 people together is better than just one. Why would you want to do that? Well, healthcare is complicated. And so when you are thinking about all the things that are happening, Mr. Joe here is just, beside himself with everything that's going on. You've got all these tubes and machines beeping and all that sort of thing going on with you. And you just want to be able to get better. You've got, let me see here. Come on. You got pills that you need to take. You got testing, the vampires, as people call them, come in at all hours of the night and day to draw your blood for testing. You've got the nursing staff and you've got everybody else, the doctors, a whole lot of people talking to you all at the same time. And it can be overwhelming for you, the patient, even for you, the loved one who is with them. So apart from that, you have all the beepings that are going on in the room, and it's just chaotic and confusing and just unnerving to you. Plus, you have the stress of the staff, the strain, the frazzle. Some of them are sleep deprived. We know all about that. So, statistics shows that patients forget 40 to 80% of what they hear. Things just go over their head. This is normal. So this is why it is best to bring somebody with you. 4 ears are better than 2. Okay, so 3 out of 4 patients ages 65 and over leave the hospital with an incorrect prescription or not understanding what their medicine is for. They don't know if they were told to stop one medication or if they were told to continue it or what. There's no instructions and you're just overwhelmed. And because of your overwhelm, you can have a cyclic kind of a situation where you go home and you're still not feeling well. So you go back to the hospital. Hospital does what they need to do and send you back home. And, it's just a revolving door. And having an advocate really does help you. So solutions and tips. First things first, if you are going to a hospital or you need to find a doctor, these are 2 areas where you can research. You have the ability to research their hospitals to see if they have a good passing grade and if their quality of care is up there. Some hospitals gain what they call magnet status, and you want to know if even if your hospital doesn't have that status, do they measure up? You don't want to go somewhere where there is a 2-star or a 3-star. You want a 5-star if you can get it. Okay, in many hospitals or surgeries, you need to bring a partner with you and bring your care checklist with you, your care partner's checklist with you, that you can find on the website. And all these things are on the website as far as what will happen if you are not on top of things. Gives you information about bloodstream infections, which we know as sepsis. It talks about the risks that you can develop from tubes and bags, and it's just a terrible situation. So you, as the patient, you must be mindful. I know you're stressed and you're like, I don't want to deal with it. Then have someone come with you to help you with that sort of thing. So you want to know what to look for, what to say, what to do, and when to get a nurse. All of these things will give you peace of mind. Talking to your doctor. For every diagnosis or surgical recommendation, get a second opinion. Too many people think, okay, I'll just take what the doctor says. But it's your right to get a second opinion, because some doctors may view something, not that they're wrong, but they may view your diagnosis as one way, whereas another doctor may view it as another way. But if, they give you the common, say, yes, it should be, or no, wait, then you have that discussion with your family. And that's when you ask those questions of the doctor, the whys and the hows and the how longs and stuff. And just remember, doctors don't have a crystal ball. They can't really tell you, well, you have 4 or 5 years to live, or 2 weeks, or whatever. They're doing a guesstimate, but we have found time and time again where doctors have said you'll never walk again, or you'll never be able to do something, and you have been able to prove them wrong. So getting a second opinion is key. Okay, so when you're interviewing the surgeon, ask the question, how many of these surgeries have you done? Yes, your neighbor down the street may have had a good experience with Dr. Smith, but then you'll find somebody at church who will say, oh no, never ever. I myself have had the experience as a nurse that if I hear of a person saying they're going to go to a certain doctor, I say, no, not at all. And that is from my experience with working with this doctor, and also knowing that they're not a good person to go to. But somebody else might say, well, they've had a good experience with them, then that's fine. If you get two clashing kinds of answers, you might want to, think about it. Ask the questions. How many of these have you done? Use your checklist that you have. Introduce yourself. Doctors go in the room and they call you by name, but do they really know you? They don't. Will you ask the doctor, will you be performing, or will it be others? Sometimes going through some notes, I realized that the doctor is either in the operating room, or he may not be, and his assistant is doing the operation. But you signed up for your doctor to do the operation. So, get that answer. Doing another surgery in a hospital at the same time, is that doctor going to get you on the table, do what he has to do, and bolt through the door and go somewhere else and not stay with you and know what's going on? Or are they going to finish what they're doing with you and then, they're on their plane and gone and left somebody, to care for their patients? That is not something that you want to know. So you want to ask these questions, and you are within your right to ask. So this represents taking notes. You have to take notes, write things down. Ask, what is the plan of care today? What is the goal? What is happening based on your diagnosis? What medications are you on? When are these medications going to stop? Will you be on these for 6 months, or, probably 2 months, or a year, or the rest of your life? You want to know this kind of thing. You want to know what your test results are. Let your doctor explain to you what your tests are about. They're talking about the CBCs and the CMPs and the BMPs and all these acronyms. And it's like, okay, what are you talking about? You know, and then they say, oh, don't worry about it. Don't worry about it. But yes, you need to know. You need to be a part of that. So you know your numbers. So you know when your white blood cell count goes up, hey, something's happening. My body is reacting. I'm having a fever. Something's going on. When you're going to be scheduling your tests, what's the best day to do all this kind of thing. So you want to be able to know what's going on. And because you want to know all these things, you know, you want them to share with you, you know, their goals, answer your questions, and so you can have peace of mind. Okay, keep track of who's who. You'll be in the hospital room and you'll see the cardiologist, you'll see the hospitalist, you'll see the resident, you'll see the anesthesiologist, you'll see the pulmonologist, and it's just, you know, like Central Park and Central Station, and they're just in and out. You'll have the nurses, you'll have, you know, the people bringing dinner for you and lunch, and it's just too much. So get a piece of paper and just write down who they are, or ask them for their business card if they do have a business card. And so you can keep things on track. Keep a notebook with you at all times, because you can advocate for yourself by asking each person who they are and what they do, and how does their coming into your room affect your care. Okay, so you've got medications also. You're in and out, and nurse comes in and says, oh, I have all these medications for you. Well, you want to know a little bit more about what's going on, especially for elderlies. There are certain medications that are not recommended, especially elders who have dementia. You can have a reaction to those medications, and the FDA has put like warning labels on these medications. So you want to find out what these medications are. Have a list of the Bears list for seniors, and there's also a listing for the pediatrics. Medline Plus .gov also has a listing of what medications are and their usage, and you know, you can find out all that information. So keep track of the medications. In nursing, we are taught the 5 rights: right patient, right drug, right dose, right time, right route. You want to know when your medications are supposed to be, what medications there are. You sometimes hear when the nurse comes in, can you tell me who you are and your date of birth? Well, they're checking your wristband, but at the same time, it's a common practice, and it's just ingrained to ask you, so you verbally say who you are. So don't get upset, you know, when they're asking, you just gave me the medication 20 minutes ago. Why are you asking me my name? It is ingrained because, you know, they may have a medication in their hand thinking that it's you when it's really your neighbor next door, or it's 2 rooms down the road. So you need to know when they are checking, they're also double checking that you are the right patient and that they do have the right medication for you. And what time, and then again, what route. You know, some nurses will say, well, okay, we have this pill for you, or this injection for you, and you're like, what is that for? And they said, oh, well, you know, you have this medication for your cholesterol. Well, the doctor never told me I had a cholesterol problem. When did that come around? Those are the things. So that makes you to be alert and aware of what's really happening. So 5 rights is key. Same thing with the labs. Keep track of what testings are done. Ask the lab technician, what are you drawing for? If the doctor came in and told you, okay, I'm going to check your labs again for, say, your white blood cell count, just to see if you came in with an infection, Has it moved? Has it gone down or has it gone up? So asking those questions, it's fine. You can ask the lab technicians, and then you can also talk to your doctor. Have that conversation. Closed mouths never get fed. And if you close your mind and you just say, okay, fine, they'll do what they do and I'll just take it as it is, then no, it's like you're a lamb to a slaughter. You have that right to ask questions. So I won't even try to answer this, but this kind of gives you an idea. Doctor comes in and says, it's simple. You have da 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 diagnosis, and you're like, huh? Because it's gone right over your head. You have no clue what's really happening. Google. A lot of people go on to Google, Dr. Google, to find out a lot of things. Yes, but the Google gives you just a snippet, but you still have to do a deeper dive, a deeper search. So for me, when I advocate for my clients and even for myself and in my family, I usually go to government peer-reviewed sites that can answer my questions. So Google has Google Scholastics that you can ask those questions. There's also Medline that you can also go type in your questions and ask, and it will pop up what the information is you want. Goes the same thing for your medications, that sort of thing. So Google is good, but for you to really truly understand, you need to do a deeper dive and verify. And it's just that somebody writing something, make sure that the information that you're getting has been peer reviewed. Okay, hand washing. Hand washing is essential. During COVID, we were taught to hand wash and everything. Now that practice has kind of gone to the wayside, and a lot of people are like, yeah, well, no big deal. But hand washing, key number one. Make sure everybody does that. The nurses, the doctors. Ask the doctor before he puts your stethoscope on you to please just use the hand sanitizer and wipe it off, because he's seen 4 other patients down the corridor. He's using the same stethoscope to talk to you and to put onto you. Do you want that person's germs on you? No. There's a reason why they have the hand sanitizers in the room. And you yourself, as you'll see in another slide, you can, if they don't have it, give them a couple drops, to do that. Ask the nurse for some extra alcohol wipes. And if you don't see the doctor doing it, tear it open and say, hey, can you wipe your stethoscope before you put it on me? You have that right. You are protecting yourself. So here's a slide. Stock up with all the hand sanitizers you can, because you're going to need it. Because a hospital, when I was practicing, I told my patients, this is not Club Med. You're not here for vacation. You're here to just find out what's wrong, get better, and get out. But infections are rampant in the hospital. So you have to protect yourself and make sure anybody who is caring for you and has to touch you or anything like that, clean their hands. Your side table, the tray where you put your food on and stuff, wipe that area off. It may have been clean before, but since you were in that room for 4 or 5 days, has it been touched? Don't think so. So you can bring your own wipe if you want to, or ask the person who is cleaning the room, please, could you wipe off this area? Do not, under any circumstances, go into the hospital and walk on their floor barefoot. Even though they say that they are cleaning the floor, still protect yourself. Wear non-skid socks. They'll probably give it to you. And if you need to ask for another one, hey, ask for another one, ask for another pair. Make sure that if your loved one is someone that needs a cane or a walker, that it is in the room. Make sure that they don't just get up and, go to the bathroom by themselves. Tell them to use the call light and ask for help, because you are at risk for fall and you do not wish to fall in a hospital. That is tantamount to another long hospital stay. So protect yourself, protect your loved ones. When it comes to these beeping machines that you have all over, your loved one is like hearing the beeping sound of the cardiac monitor, and your IVs and all that. It's just unnerving and unsettling. And we know when you get to the hospital, you don't sleep, but to help your loved one, bring some earplugs, or, even a mask so they can put it over the eyes so they can, just calm. Even using essential oils can help to calm somebody, like lavender or eucalyptus. Those things are helpful, and a lot of hospitals now are using essential oil therapy. Manage visitors when they come. If they're coming in and your loved one is trying to rest, tell them to be quiet or be considerate of other patients that are there. It's not only your loved one that's there in the room, it may be somebody else is there too, and they may be sicker than your loved one or you yourself, so be cognizant of that fact. When you need help, call a nurse. Use your bedside alarm to call a nurse, because you don't want to just get up and start walking. It's tantamount to you causing yourself more harm than anything else, because you've got all these wires and everything that's going on. So if an alarm goes off, you hit that button that they give you to call a nurse. Prepare for watchful weekends. This is something, if you have to schedule a test or a surgery or so, and it's non-emergent, like you have knee surgeries, lifts, or breast reconstruction, it's not an emergent situation. Try and see if you can schedule it on a Tuesday or a Wednesday, so that most likely you'll be discharged by Friday. Because in the hospital, if you have to be there on the weekend, staff is skeleton staff after that. So that's a hard thing for you. So you won't get anything done. But if a weekend stay is needed, consult with all the doctors about any potential problems to watch for. So say you went in on a Friday and you had surgery. Well, what are the things you're watching for? You're watching for excess pain, increase in pain, headache, nausea, vomiting, loose stools, all those things. Are those things attributed to your surgery or not? That's a change in your condition, a change in your loved one's condition. You want to be on top of that. Get the doctor's contact information. Some doctors will, give you their contact information. They may be, going out or so, but they say, call me if there's any questions or concerns. The nursing staff, they have their number, but usually doctors who are going off, they report to another doctor that is coming on. Or if you're at home, not even say at the hospital, but you've been discharged home and something happens on the weekend, your doctor is not available, but there is always a doctor on call. Do not wait. Do not say, well, okay, I'll wait till Monday to get in touch with my doctor. No, because you can't see what's going on inside of you. So it's better to run to the hospital, get the care that you need, and be on the safe side. Another thing you want to do is arrange for 24/7 care with your loved ones. So somebody needs to stay with grandma at least for the first 24, 48 hours. Friend, family, whoever it is, even if you're at the hospital, have someone there with you. The nursing staff, once they know that you have an army with you, you will see a totally different attitude as far as your care is concerned. So you need to make sure that somebody is with you all the time, because if somebody comes in and talks to you, you're out of it. You really have not heard what's going on. And so your loved one will be the one to take the notes and to ask the questions on your behalf. So you're in the hospital and you notice that mom is just, she was talking to you fine 20 minutes ago and now she's lethargic, and you say mom, and she's, hard to wake up. And so that is a change in condition. And if you have called, press the call light, and the person says the nurse will be right with you, and you've waited a while, you have the right to call the hospital 911 number, not that you're calling 911. You call 0, which is the operator, and you say, I am calling a condition, I'm calling for a condition help. I need the response team, if that is something that is really, really needed, if you don't get a response. And you give the name of the patient, your loved one, and you give the room number. You'll see how many people start flying in. So if they notice that there is a change in condition, then we say we're asking for tests. Get to the root cause. What caused this change to happen? You need to know where this thing, rooted and started getting out of control. Change in mentation. It can be from a staph infection. It can be from a urinary tract infection. Medication side effects. Overdose from a medication, a narcotic drug interaction. I myself today had to go for a test, and they gave me the isotope injection for radiology. Well, you have that warm, fuzzy feeling, but after that, that's the first reaction I had, was that I wanted to throw up, which has never really happened to me before. But worse than that, it triggered my asthma. And if I was not on top of it to say, okay, fine, I need to use my inhaler and stuff like that, I'd have been probably in the parking lot and several cars would have run over me before somebody realized what was happening. So be cognizant of what is happening. Sometimes confusion can result in can result from too much time spent in a hospital room, because elder people, they get their orientation to day and night gets changed and switched around, and they don't know what's that. So you have to constantly say, okay, today is Thursday, July 17th or 13th, sorry. And you're in Mercy West Hospital and I am your daughter. And you ask the questions. Do you know who the president is? Do you know your date of birth? Those kind of questions. If they can't answer those questions, or they give you some kind of off the wall answers, something is wrong. You need to have somebody to check them. Okay. Your loved one is getting better and all is well. Now is the time to take the time that you need for discharge. So you need to ask to talk to the discharge planner. It can be your caseworker, it can be a social worker. There has to be a plan in place for you to go home. Is this a safe discharge if you're someone that lives alone? If that is not safe for you, you've had hip replacement or you had knee replacement, and you're like, I'm adamant, I want to go home. Well, that's not safe for you. Who do you have in place that in the event that something happens, they are right there with you? So you need to have that plan, and you need to communicate that plan to the discharge planner. And you also want to take notes. Imperative that you take notes. Okay. Record your discharge instruction, regardless whether you're a solo ager or you're with someone. Explain to them, everything you say to me is important and I don't want to miss any details. I want to know what's really going on or what I'm supposed to do. It is your right to ask these questions. Remember, check in with your loved ones every day. If someone is not there with you, or if you as a daughter couldn't stay with mom or dad for the time being and you had to fly back to work, check with them every day for at least a month. It is a good thing at this point, if you don't have a patient advocate, to look into getting a patient advocate for your loved one. That person can go to the home, make sure that everything is okay with your loved one. If they are in the hospital, they can be there at the hospital advocating for your mom or your dad and on your behalf. They can be the ones to watch and listen for any signs of any setback in recovery. They can be the ones to report back to you. So you need to get that help. All right, so keep calm and carry on. It's okay to ask for help. It is okay to ask for help. Here are a few websites: lotsofhelpinghands.org and Caring Bridges. These two areas are people who have private pay caregivers that you can employ if you are not available. You can ask friends or family. You can ask your pastor who he has in church that would be someone who could help you, in your time of recovery. Also look into having a professional advocate with you. Also remember that nurses are people just like you, that they juggle several things. So they have the home, they have the job. It's stressful. They've worked more than 60 hours, which is really not a good thing. But sometimes being short staffed, all hands on deck. So your loved one and yourself, if your loved one is not able to assist themselves, can ask, how can I help? If it's an able-bodied person and you're able to get up, you've been given orders that you may get up. You were given orders that you can get up and you can move around and sit in the chair and stuff like that, then fine. If you're going to visit your loved one, you want to ask, can I bring you a coffee? Can I bring you something, a donut, or it's just something for the staff? It's appreciated. It is totally appreciated. Also, keeping the room very tidy and uncluttered, it helps to keep off the floor and prevent trips and all that sort of thing. So, keep the area where you are in a tidy manner. So, questions that I can answer for you. And again, this was brought to you by the Care Partners Project. And you can go there. Here is the website that you can go to and get all the information that you need. Hello.
Well, hello, Barbara. That was great. That was awesome. And I will tell you that, if you have spent any time in a hospital with family members and stuff, it is what you're saying is so critically important. I don't know if everybody has done that or not, or if they just think that everything's going to be fine. I can think of all kinds of things that, my mom, for instance, is a Parkinson's patient. And it seems like none of the medical professionals are really all that up to what that means. Okay. And so getting them to understand that the timing of her meds is critical. It's not, I think they have an hour, leeway at the hospitals, but she doesn't. If you mess her up by an hour, she's, it's going to take a day or two to get her back on track, so exactly. It's that type of thing.
Exactly.
knowing the fact that if you give her a protein meal, it makes it too close to the time of the meds. It's not going to, the meds don't work, you know. So you're sitting there
Timing
having
is
to
everything. Timing
and,
is everything.
and you have to argue with them because they keep acting like you don't know what you're talking about. Going, no, trust me, you know, this is the deal.
So
Yeah,
this is the conversation that you have with
yeah.
the doctor.
Mhm.
And you say to the doctor, look, mom is here, but she gets her medicines at this time. Please write the order, because the nurse will do it. Say the medication is due at 8 p.m. Can she get it at 7:30, or can she get it at 8:30, or can she get it at 8:15? Write the order, be specific, because then the nurses are know that, okay, fine, Mrs. Morgan needs to have her medication on time, and we need to get it there, or else suffer the consequences.
Yeah. Well, yeah, because I'm just saying, but it's just one of those, you know, it's like, and we've been very blessed. We have a nurse advocate that we have our family uses, and I for both my mom and my uncle.
Mhm.
And I have been, way too many hospital rooms and ER rooms and whatever, where we're sitting here going through this with them. And I have learned very quickly that the staff, the doctors and nurses, will talk to her differently than they do me.
Mhm.
They will tell her more information than they do me. So I have a tendency to just shut up and just let them let them, because then I get the bullet points, you know. So but it's but I have found that they will tell me one thing, but if I have Michelle there, they tell me something, you know, they'll tell her much more information that's much more pertinent, you know. And I don't know if it's just a professional courtesy thing, or
It's
if
it's
it's
it
they know
it
that,
it
or she knows they're BSing.
Yes, that is one thing. Because when I am with my clients and I go with them to doctors' visits, it's a total different atmosphere. You're not just that person that they go, "Hi, how are you? Everything okay? Okay, fine," and they're out. They're here. They see that you have an advocate. Now they know, okay, fine. This is a nurse advocate that you have, and so here's the conversation and the back and forth. It's it's
It's
it's it's that it's a game changer.
it's
It
a
is a total game
it's
changer.
worth its price in gold. I mean, you know,
Mm-hmm.
Michelle is way cheaper than what we could benefit from, you know.
Mm-hmm. Mm-hmm.
So hang on a second, let me hear this. I had a call coming in. But anyway, but that is something that we have experienced firsthand and over again. And it's just a big difference in that. I know that's what you do as well for people. So
Yes.
but I don't know a lot of people realize, until we stumbled upon her one time, I had no idea that this service was available for people, and
Available.
it's well worth it.
Yes, absolutely. Very much so, well worth it. A lot of people think, well, no, they can't afford it. But my thing is this: if you can afford, and I dare to say this, but if you can afford to buy a whole bunch of stuff on Amazon that you really don't want, but you just thought you needed it, what are you really looking at? Are you looking at quality of life, or are you looking at quantity of life? Advocates can give you quality of life. They are there to help you maneuver the complications in the complexities in the healthcare system, to give you peace of mind, to empower you by education. So helping you in that respect is worth its weight in gold.
It really is.
And
And I had an experience years ago, okay, that opened my eyes to, I think I've always seen medicine and doctors and hospitals very differently since this experience. Okay. Um, I was I was working in a real estate related way to a pathologist who was investing in developing a piece of ground. So I was
mhm,
helping him in that. But I got a chance to spend a lot of time with him, you know, in his office or in his lab, or you know, or with he and I might be meetings at the building sites, but also the call comes in. I'm listening to the other end of this conversation, And it completely changed my perspective. I can't tell you how many times I heard him screaming at some doctor going, get her off that meds immediately or she'll be dead by tomorrow. That kind of, and he had the bedside manner of like that guy on TV on House, so he
Yeah.
was really good as a pathologist. So, but a brilliant mind. Okay. And it's like, but it really taught me that you don't just necessarily take everything as gospel when they come in. I recall we had my wife's grandmother was having all kinds of problems where her body quit making blood. Okay. And so she'd have to go in and get topped off every so often. It was like, and all the doctors, no one knew what was going on. No one had any ideas. No one could explain what was going on. So I'm telling it to, my doctor friend, my pathologist friend. I'm 100 miles away from where she was. Okay. I'm at least third, if not fourth hand information at this point, telling him. He goes, go back and look in her medical med cabinet. And he goes, if she got this drug, and this drug, and he goes, in combination for any period of time, it shuts down the body's ability to make blood. Guess what we found there?
Yeah. The meds that he said.
Yeah. And we diagnosed it. He diagnosed it from 100 miles away at fourth, and so my question was, did the other ones not know? Were they not asking the right questions, or they did not want us to know? And none of those answers are good.
I shouldn't say this, but this is why they say practicing medicine. Operative word, practice.
Yeah. But it does show how critical it is to have someone there.
It is.
Have another set of ears, another mouth, especially if you're sick and you're not feeling well and your head's fuzzy anyway.
Yeah, absolutely. And you also have you have to so be in tune to your body. And if nobody will hear you, then that's a problem. Then you're going to need to go outside of your community, because I had a client that her primary knew her from toddler. She's now a young adult. So that history, you just put that blinder on and that's that there. But if you got her to another place and totally different thing. And even though she's still suffering, but at least the plan of care is a little bit better than what it was before. So sometimes, you may have a doctor who has been in the family for so long, and so is clouded their judgment as far as what's really happening. Or it can be too that they are not clouded, and yes, they do know what is happening. So you yourself have to advocate and know who the doctor is that you're dealing with, and can they help you. If they can't help you, ask them to recommend you to somewhere. Go on to Dr. Google and try and find the society. There are, cardiology societies, there are ortho societies. Find those societies that are there, that have lists of doctors that can help, in your area. Interview them. It's your right to interview a doctor,
Well,
and
I had a doctor personally that I just loved her. She was awesome. And when the Affordable Care Act came out, she said it wasn't worth it for her to be a doctor anymore. So she just went home to take care of her kids. Okay. And so, and her husband was making enough money. She couldn't do that, right. And so all of a sudden I'm having to find another doctor. And I found one. I loved him. He was awesome. And then he ended up going back into the military. And
oh no.
So then I ended up in with a third one out of that clinic, and I fired him after one appointment because he did not listen to one word I said. I was like, dude, you and I are not going to get along, so it was, I've got a guy now I like a lot, but it was literally one appointment and nothing I said did he listen to. And I'm going,
right,
we're done, so.
Yeah. That's it.
But a lot of people are afraid of that. There's like the doctor with the white coat is omnipotent. Well, they're not. So
absolutely.
Well, I think that's I had another story, and again, why it's important to listen and to question. And this was way back, but my grandmother was really getting feeble and was, getting to where she was using a walker and having all these different issues. And she went to for some reason, went to a different doctor who was a younger doctor. And the first thing he did was wean her off all these drugs that the other guys had her on. Okay. And she went through a lot of withdrawals. I mean, in that
Mhm.
process. But all of a sudden, the walker's gone. She's doing fine. She's, getting along great. So my grandmother, being my grandmother, which may tell you more about my personality than anything else, but she made an appointment with the old doctor, went in. She hadn't seen him in about, a year. She went in to see him, and he looked really shocked to see her. And she goes, "You thought I was dead, didn't you?" And she gave him an international hand gesture that, and then walked
Ouch.
out.
Ouch. Ouch.
But anyway, but again, it completely changed her life because she
Mhm.
got, she took a proactive approach to find out, the
Right.
doctor wasn't always
Right.
right, so.
Hmm. Yeah. The key thing here is to be aware of your body. What medications are not working for you, what the side effects are. Ask your doctor, okay, you're giving me this medication. Talk to me about this med. Am I going to stop one medication and start this? How do I integrate both of them? Do I take one at one time and one at the other time? Those questions you need to ask. You can't just say, okay, fine, he's called it into the pharmacy and I'll start taking it. You need to know what you're looking for, because if there is a change in your condition at home, and you have to call the paramedics. You need to let them know, hey, Dr. So-and-so started me on this medication and this is what has happened. You need to let that know. And another plug here I will say for people is, for elderlies, leave a list of their medications on the fridge. In the event that there is an emergency and 911 has to be called, they have the current list of medications right there on the fridge. And if they have a DNR, it's right there on the fridge. You can put it in an envelope in a pouch and stick it up there in emergency or for EMS, whatever that is. And leave contact information there for them also. So they don't have to hunt and peck. If your loved one is unconscious, well, what did she just take? Well, look at the list of medications, so they at least can tell the ER doctors and nurses what took place, so they can then work back and see, okay, what was really happening. And the other thing too, I would stress, is that for those younger people and even adults too, who are taking recreational medication, recreational drugs or whatever, you have to be honest, because if you go into the hospital and you are not breathing or something and they have to use Narcan on you, and you say, well, I've just taken just 2 aspirins. Well, aspirin doesn't cause you to have Narcan. That's just not there. Be honest, because that honesty helps to propel what your course of treatment will be. That is key. Absolutely. So,
Well, yeah, I was going to say that because if they don't know what's in there, then they put something in there, it's causes even more trouble,
yeah,
so.
exactly. And then, if the doctor in the ER doesn't know that and gives you a medication and you start seizing, you're like, but this medication shouldn't allow you to seize. What's happening? And you didn't say, or your friend or your loved one didn't say, well, he, had a couple draws of, some weed or, fentanyl or whatever. So it's true to be honest with the healthcare providers. They're not there to judge you. They're there to try to keep you alive. That is key.
Oh, very
Absolutely.
good. Well, like I
Yes.
said, what you do and what others like you do. I think I didn't know anybody did such things until we just stumbled into Michelle. Okay. And
Hmm.
then now, of course, I'm in the senior industry and I know much more about it, but it's like, but I didn't know. And it was like literally a life-changing event for us to find her, and
Yes.
so,
Yes.
and of course she's now part of the family basically because of this, but
Yes.
um, but but I will tell you, for a while I thought she was the only one. Then I found out there's other people. Makes me sleep better at night because I don't know what I would do, if she decided, well,
Yeah.
I'm tired of this, But anyway,
Yeah, there are other advocates, not only nurses, there are doctors, there are therapists, they're just people who have, like Karen here, who started the Care Partners Project, who has had a loved one that has had a medical event and just decided, hey, I don't want somebody else to go through this. How can I put it out there that people will hear and know what's going on? And you can find advocates. They are, just type in patient advocates for your area. There is Advocate X, there is the National Association of Healthcare Advocates, there is AFA, which is the Alliance for Professional Healthcare Advocates. There is one started by an attorney, Greater National, that's listed in Chicago. He was a recipient of a bad diagnosis and ended up having sepsis with amputation. He still practices law, but he is adamant that people need to have an advocate in their life because those are the people who can help. So, these are the things that we need really and truly need people to understand. You need to have an advocate. There is also the Patient Advocate Foundation for people who can afford an advocate, because patient advocates are independent. They are not covered by insurance, because if the insurance companies, we were covered by insurance companies, we'd have to go by their rules and regulations. And if a hospital says, well, we have a patient advocate, yes, but their service stops at the door.
right.
We can go in and out of the door and we don't have to comply with their rules and regulations. We work for you.
Well, in fact, that's the critical point there is they may not want to do these things because they don't want to pay for them. So they need that's when you need someone to go, hey, no, 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 no.
Yeah.
Now the biggest problem I find with the nurse advocates or the advocates is that you guys call yourself so many different things. I mean, geriatric care managers, there's all these different terminology.
Yeah, just to get into a niche.
Yeah.
So for me, I mean, I am just a nurse advocate, nurse patient advocate, nurse advocate. I am a nurse. I'm telling you, that's what I do. So I do medical navigation for you. There are advocates out there who do billing. You get a wafted bill and you're like, where did this come from? And you have those people who can help you with your medical bills as far as negotiating it down or saying, okay, fine. The hospital coded it off by 1 digit. And that changed the whole situation. So if you're in the hospital, make sure that you get a bill, make sure that you ask for an itemized bill. Make sure that you know what your insurance will or will not cover, because then the onus is on you. So you can't feign ignorance.
Yeah, you also mentioned something that was unless you've lived it, you don't really know it. But weekend staff and holiday staff at hospitals is you're basically almost in a Stephen King novel. It's just the fact that you're all there by yourself in the overlook hotel. So
yeah, absolutely, absolutely.
Well, Barbara, is there anything else you want to make sure you get the message out on? How would people get a hold of you? I'll put your information on below the thing when we send it out too. But
okay, yeah, for me, product consulting and advocacy. You can call me at 513-250-0617. The advocacy platforms that I was just talking about, I am also listed on there. I am also listed on the Care Partners Project on their website also. So I'm here. I'm here to answer any questions that you may have. I offer a free 15 to 20-minute consultation. If I can help you, I will. If I can't, I won't leave you say, well, okay, I can't help you, I'm so sorry. I will definitely find somebody or some organization that will give you the help, because that's what we're here to do. We're here to help each other.
Well,
Absolutely.
thank you, Barbara. I want to show
Thank
people
you.
real quick something real quick. If I can do a share here. Okay, so basically, this was Barbara here, but this was brought to you by, Life's Co-Pilot and Caring Transitions and all of our partners. So please make sure to, to take a look at the different partners in here and let them know that you enjoyed getting this information, because they're the ones that are providing it for you. So I just wanted to share that. That's at lifescopilot.com under our partners. So Barbara, thank you so very much.
Thank you. Appreciate it.
All
Talk
right.
to you
Have a
soon.
lovely day.
You too.
All
Bye
right.
bye, Jim.
Bye-bye.
Bye.